Hi there, Wildcat. My name is Leslie Ralph, and I'm a psychologist at Counseling and Psych Services. I know the last few weeks have probably felt crazy and uncertain. It probably feels like a lifetime ago that you were walking around campus. With all of the changes happening and so quickly, I wanted to take a minute to slow down and ask, how are you doing? This is a strange, uncertain time we're in, and everything feels weird and different and scary. Just like you, I'm working from home in the corner of my bedroom, trying to figure out what all this is going to look like in the end and trying to find some sense of normalcy. I have some tips to share with you today on behalf of CAPS and Campus Health, because above all else, we want to help you stay healthy in body, mind, and spirit. So let's start by defining what stress is and why you might be experiencing it right now. Stress is the body's natural response to threats in the environment. Changes in your daily routine, uncertainties about your future, and situations that feel out of your control are all the kinds of threats that we experience in daily life. So many things, big and small, can contribute to stress. Midterms, roommate arguments, financial strain, all of these are just part of normal life. So when we add in something big like this global pandemic, you're definitely going to feel it. The constant stream of data and input is stressful. The unanswerable questions are stressful. The risk is stressful. And the actions that we have taken and may be asked to take in the future are stressful. Things like quarantine, remembering not to touch your face, or canceling the plans that you've been looking forward to for a really long time can all be pretty hard to cope with. It's important to keep in mind that while it's unpleasant, stress isn't your enemy. It's your body's way of alerting you to a problem and motivating you to take corrective action. And that means that the stress signals your body's been sending you are important to listen to. Managing stress, anxiety, depression all begins with listening to those signals and learning how you can best support your own well-being. You see, stress isn't the enemy, but when left unattended to, it can take a toll on your body and your mind, your relationships, your school and job performance, and almost anything that's important to you. It can make it hard to think clearly and respond to things in the way that you normally would. So right now, you might already be noticing changes in your sleeping or eating patterns. This might be especially true with the significant changes in our daily routine that we've all been experiencing with social distancing. You might feel sad, anxious, or irritable, maybe even a reaction to things that feel small or insignificant in normal life. You might have low levels of energy, difficulty concentrating, you might feel tense or restless. For some, stress can also lead to increased use of alcohol, tobacco, or other drugs, worsening of medical conditions, and physical complaints like headaches, upset stomach, and insomnia. All in all, stress can make you feel and act like you're not yourself. The good news is that there's a lot that you can do to manage your stress, even when you're stuck in the house all day. Self-care will probably look different now, but think of it as your opportunity to learn more about yourself. Here are 10 ways that you can take good care of yourself during the COVID-19 pandemic. 1. Try to establish a simple and sustainable daily routine. Pay attention to the flow of your day and how it's working for you. Are you finding yourself with too much unstructured time on your hands? Are you filling your time with busy work and projects? Or are you checking the email when you'd normally be relaxing? Try to create a routine that you can repeat consistently day by day that includes activity and rest. Include the important elements of your life in your routine. So for example, give yourself time for pleasant physical activity, intellectually and creatively stimulating activities, quality interactions with the people that you care most about, work or school, and quality time to yourself. To start the day off right, try setting an alarm, ideally for the same time every day. Getting out of bed and getting dressed, even if you have no one to impress, and scheduling something to do in the morning, even if it's only an appointment with yourself to go make a cup of tea. To end the day on a positive note, turn off the news and give yourself some pleasant, relaxing time in the evening. Try to give yourself at least 30 minutes to wind down before bed. During that time, turn off all media, turn off the screens, do something soothing and calming that allows you to get sleepy. 2, make sure sleeping and eating are on track. Keeping a sustainable and healthy routine also means engaging in healthy sleeping and eating habits. So as best as you can, try to get up You go to bed at the same time every day and eat consistent meals. And even though you're inside a lot more right now, try to see the sun first thing in the morning and the last thing in the afternoon. This can work wonders for your circadian rhythm. 3, make a fun to-do list. It might be hard to think of what to do in a moment of high stress or boredom, so prepare yourself with a fun cheat sheet. To make one, set a timer for 5 to 10 minutes and list everything that you can think of that you enjoy doing from home, anything that you've wanted to try or have access to. Make a wish list of books to read, movies to watch, or skills to learn, or topics to study. When you're done, give yourself a little break and then come back and review your list. Put a star beside those ideas that excite you the most, and as best as you can, gather any resources that you might need to begin one of these activities very easily. Then start to schedule them, and don't cancel on yourself. 4, keep in touch with the people that you care about. Pick up the phone, write a letter, turn off the news, and reminisce about happy memories. Remember that it's okay to talk about your feelings about the outbreak, and it's also okay to take a break from talking about it. Let your feelings be your guide as you decide what's right for you right now. 5, if you have pets, give them extra loving attention right now. Go ahead and pause the video and do it now if you can. 6, identify your strengths. Remind yourself that you've been through difficult times and you've accomplished great things. Think back to the difficult times in your life and your past successes with compassion and an open heart, and reflect on what you've learned and what those times have taught you about your unique strengths. 7, practice compassion and embrace the solitude. I know this is something that most of us aren't used to, and it's one reason this whole experience is so challenging. Try to take a little time every day to be quiet and still. Keep a diary, start a gratitude journal, stretch, or enjoy a quick meditation with soothing music, even if all you do is close your eyes and breathe for a minute. Now, you might have noticed that the people around you are pretty stressed too. This pandemic is part of our shared human experience the world over. Even though we're all seeing the same statistics and going through many of the same challenges in daily life, we're not all going to react in the same way. Keep this in mind and try to offer everyone, yourself included, plenty of patience and compassion. 8, forget about the outbreak for a while in the little ways that you can. Give social media and the news a rest every now and then, and enjoy activities and conversations that are completely unrelated to COVID-19. Let yourself laugh, dance to your favorite songs, dye your hair at home, start a new hobby, write a short story. Remember that you're a full person with a variety of interests, ideas, and ambitions. 9, but have a plan and use appropriate precautions. The pandemic is real, and there are real risks, even to young adults. So in the little ways that you can, be prepared. While you don't need to know all the details or have all the answers, and goodness knows that none of us do right now, a basic emergency plan can help curb fears about what might happen if you or a family member gets sick, loses a job, or can't access food, healthcare, or other essential services. Make a list of emergency contacts and talk to them about how you can support each other. Keep your doctor's name and phone number handy and make sure all of your prescriptions and refills are up to date. And make sure that you have all the essentials easily on hand. And if there's somebody that you're worried about, reach out to them, give them a call, and ask how you can support them during this time. 10, and finally, reach out for the support that you need. This might come from friends or family or someone in a helping profession. I know that asking for help can be hard, but you are so worth taking care of. So those are some tips for you on coping with stress related to COVID-19. Please know that we're all in this together, and at Campus Health and CAPS, we're rooting for you and your wellness. Take care.